Well, they say, right, beauty is in the eye of the beholder, right? I mean, it's not just the external, it is also the internal, how you carry yourself.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Christine Moore, the owner of All New You Med Spa in Palm Coast, Florida. She's a board-certified nurse practitioner and master aesthetic provider. She's known for her exceptional level of care and commitment to delivering real, results-driven outcomes. With a focus on natural-looking enhancements, Christine creates personalized treatment plans tailored to each client's goals and budget. With over 21 years of experience in laser and advanced aesthetic treatments, she now focuses on reverse aging solutions, helping clients look and feel their best from the inside out. Christine has completed advanced entrepreneurial training through The Blocks, a business incubator for startup companies developed by Wes Bergman, participating in both season 5, 7, and has been selected to attend an international business program in Barcelona in August 2026. So Christine, welcome and glad to have you here.
Yeah, thank you. Thank you, Daniel.
Yeah, so let's start at the very top. How did you first get interested in the medical field?
Oh, well, I really didn't have that desire to go into medicine. I mean, I started out wanting to be a fashion merchandiser.
Oh, okay.
Right. That's what I wanted to do. I wanted to do window decorating, in the Macy's and all those. It was extremely competitive. So I ended up going into business management and worked in retail management for, I don't know, a good 20 years, I think it was. Started out at the bottom, worked my way up to the top, where I was a district manager traveling from Maine to Rhode Island, supervising multiple locations. Then that company went out of business, helped them close all the stores I helped them open. And then I went on and did some direct sales, door to door, business to business, and residential, a multi-level marketing program where I, once again, started at the bottom, built a team, moved to Maryland, had my own advertising company that promoted restaurants, golf courses, ski resorts. I even did some work for the New York Yankees when they were having trouble filling the stadium before that stadium was rebuilt, and they don't have any problems now.
Yeah.
And I don't know, you're probably too young to remember all that. Anyway, then I wanted to have kids and went home, started again at the bottom. I don't know how many times I started over. So now, had I just started in medicine in the beginning, like, I don't think I had the stomach for it. But then I went to school. I came to Florida thinking I was going to retire, and I went and learned how to do electrolysis, which was hair removal, one hair at a time using a needle. Started out in my home. And then the Board of Health showed up, said, you can't work in your home. I supposedly in the state of Florida you can. However, the city and the county wouldn't allow it. So I had to go work inside of a day spa. And I did that for a good 15 years while going to school, working multiple jobs, raising a family. And then I became a nurse, then a nurse practitioner, and turned my hair removal business into a med spa in 2018. And so I've been operating as a med spa since 2018, building it one block at a time. No financial backing, only the jobs that I've worked. And so, yeah, I mean, a lot of these med spas are backed by big private equity firms. That's not me. I built this myself.
Wow, that's really impressive.
I may not look as old as I sound, right? And with that background, right? So,
yeah, I'm doing all the adding up, like this for 15 years and this one for 20 years. It's like, man, like when did you start? Like were you in your diapers when you started?
No, I'm in my early 60s.
Wow, impressive. I love your energy. I love your energy. I imagine like from just your background, like started up, kind of brought it up to the top and then started over again, went up, like some of the bottom, went up to the top. Like you gotta have a lot of energy for that.
I'd be a lot further along if I just started
there.
Started there. But it was not what I was, but you know what? I don't know that I would have been able to build a med spa as a solo entrepreneur had I not had all that training. all that business management, all that direct sales, door to door, all those doors being closed in your face.
Yeah. You learn a lot real quick that way.
People quit. We
Oh,
see
yeah.
it every day, right?
Yeah. Yeah.
See
So,
people.
yeah. So what was it about? I mean, because you, obviously, like your background, you kind of get into something, you build it up. You get into something, you build it up. What was it about this go around where you decided to start your own practice? I mean, I kind of get like, I want to say like there's the entrepreneur spirit, but like you just like there's like a little bit of that entrepreneurial spirit, but also like getting something new and then building it up. But like, why your own business this time around?
Well, it wasn't, I mean, that sales and marketing one, the direct sales, that was multi-level marketing is your own business, right? Well, obviously working for yourself is amazing, but what you don't realize is it's 7 days a week, 24 hours a day. And you don't realize you're basically making like $3 an hour by the by the end of all that math and doing all that work.
Yeah.
I guess working that hard for other people and not being treated like you are worth the time, the money. They feel like you're maybe looking to step in and take over their business, which was never ever the case. But always that pushback. Oh, mind your own place in our business, right? And so I always thought it was a good thing that you would work extra hard for your right. Well, guess what? It's not always appreciated. People feel threatened, right? So I guess I have that kind of energy that looks like I might come over and take over your business, but it's not that. I was not looking to take over anyone's business. So I did get hired and used to help open up some clinics in Florida. They were infusion clinics, and then once they got open, they said, "Oh, we don't want you to do this anymore. We just want you to be the nurse practitioner." And then I was gonna have to drive all over the place. I'm like, "Oh no, that's not happening." And so, and other people that wanted my job said, "Why don't you just build up your own business that you already had running?"
Yeah.
I'm like, you know what? I'm gonna do that. I'm gonna do that, and I'm gonna put all that energy into my business. And now I'm running a multi-million-dollar med spa.
There you go.
So,
awesome.
there you go.
Okay.
So that's why.
Yeah. Okay. So now that you have this med spa, I want to dive a little bit deeper into the treatments that you provide.
Okay.
Now, within the introduction, we talked about kind of reverse aging. So reverse aging, can you talk a little bit more in depth? Like, what does it mean by reverse aging?
Well, when I first started getting into the aesthetic, the injection portion of aesthetics, I mean, I'd already seen a lot of people that look funny with a lot of filler, filler upon filler. And I knew that wasn't what I wanted. And when I started my training, the opposite was happening. Less filler, more biostimulation, things like Sculptra, PRP, Radius, microneedling that will stimulate your own collagen naturally so you can look more natural and not look overfilled and puffy. So that was something I was in for. I was like, okay, I don't want to look funny. I don't know that I want to have a facelift. I might at some point, and everything I'm doing won't prevent me from having a facelift. So I like the biostimulant. I mean, that's what I do for me. So
okay. Now, when it comes to the reverse aging part of it, how do you, I guess, differentiate between the things that you do kind of like internally, like sleep, wearing sunscreen, eating good food, hydrating, all that, versus the, I guess, like the external stuff, like the Botox, the filler, like all the other, maybe not topical, but like things you do kind of with machines and outside. How do you kind of balance those two?
Exactly, because I realized I was like, okay, he's not just asking about the aesthetics, external. I'm like, we also have to talk about bioidentical hormones, testosterone, estrogen. That's about 50% of fighting the aging process. So as we age, the body starts breaking down, hormones start to leave the body, and before you know it, you're shrinking, muscles are going. And so if you keep those hormone levels up, you're going to slow that aging process down. So we have that. I do the GLP-1s, which we're actually saving lives with, right? I've never seen an obese 90-year-old. Not once.
That's true.
Never.
Yeah.
So if you're looking to live longer, better get some of that weight off, right? And so diet and exercise comes along with the GLP-1s in our clinic, right? And then we start talking about the testosterone, estrogen levels. We also offer IV infusions. We have some peptides, but we're about to do a deeper dive into peptides as well. Anything and everything that's out there to slow the aging process, because I don't want to die. I don't.
Yeah.
I don't want to feel like I'm dying, that's for sure.
Yeah, that's the other big part. You may live a long time, but if it's a poor quality of life, you probably don't want to live any longer.
Exactly. So, and then of course, sunscreen. If you're going to be working on your skin, I mean, I have people that come in, they're constantly in the sun. I'm like, it's like trying to fight cancer with cigarettes. You can't just keep going out in the sun and then expect to look younger. So yeah, we have 3 medical grade skincare lines that we carry. Trying to think of what else. Am I leaving anything out? I do some PDO threads as well. I know how to do them. I put them in, but if someone's I have to ask, are you planning on having a facelift? A lot of surgeons, you may be restricted if you put PDO threads, the lifting ones, the ones that go in the face like this. If you plan on ever having a facelift, you might want to cut that out because half the surgeons might say no to you.
Okay, good to know. Now, I want to dive a little deeper into the hormone side of it because I think it's something that is becoming much, much more prevalent to people, especially as they get older, especially females as they get older, going through perimenopause, menopause, and the whole thing where they lifted the black box warning on the hormones finally. So I think that there's going to be a huge influx of that. But can you guys talk about that for people who just have not heard about anything about hormones or kind of not realizing, like as you get older, as you go, especially the females, as you go through perimenopause and menopause, like, and all these symptoms that they experience. Like, can you kind of talk about like what are those symptoms, and then why is it so important to replace those hormones that they're losing?
Right. So some women experience things like they're getting headaches, or they're not able to sleep, or they're having hot flashes. That's an easy fix. They come looking for the solution. They know it's their hormones. And then a lot of people are going to the doctor and saying, I'm really tired, I'm fatigued, I'm doing everything right. And the doctor's going to look at your labs and say, but everything looks normal. It's within range. You're just aging. And no one wants to hear that. They're looking for a solution. And that's kind of where the functional medicine, hormone therapy started coming into play, although that's been around for a long time. I have patients that have been on it for 20 years. It's not new. However, that black box warning was recently lifted because so many people are doing well on the hormone therapy and feeling more alive, more energetic. You see all these people playing pickleball, right? Yeah. Super active. You can build muscle easier if you have testosterone on board. But we're bringing the testosterone levels to a high level. It's not within the range like the rest of America. And all those labs are developed on those people that get their labs drawn every 3 months, which are the sick people, right? So I'm looking for those levels to start changing and increasing because women, their range might be somewhere between 4 to 40 on a normal lab for testosterone. We bring them up to like 200-300.
Wow.
So I have men that come in and my testosterone level is higher than theirs.
Wow.
I know. I hate to tell them that.
Yeah.
Because then they're like, put them in now.
Yeah.
Right? They get about, I don't know, anywhere from 2,000, 2,400 milligrams of testosterone put in. We might do it for them every 5 to 6 months. But basically when the hormones start to leave, other things start to break down. I mean, just as we talk about facial aesthetics, that skull is shrinking, the jawline's receding. We're shrinking in height. I think people knew that long ago, right? Yeah. That we started to shrink. The spine starts to collapse. And so other things I noticed, like since my testosterone therapy that I'm doing, my bone health, my teeth, doing much better.
Wow.
So we're talking about slowing aging. I don't know how else to put it, but
yeah. So when it comes to the hormones, would you say would you kind of go as far as saying that every single person should do hormones at some level? Or is it really going to be for certain cases where it's like, okay, you need hormones, for other cases, like you don't really need to do this?
It's a choice. I mean, you're going to have a lot of women that have had breast cancer that think they can't do hormones of any kind, even though they can have testosterone. Testosterone has been used to actually shrink cancerous tumors. So I don't know. I'm sorry, what was the question again?
Like would you go to so far as to say that everyone as they get older should
Oh,
be on some type of hormones, or is it's only gonna be for certain groups and other groups like they really don't need it?
I think everyone would benefit from it.
Mm.
Can they survive and live without it? Yeah. And some of it comes to the genetics. You can't change the genetics you received at birth, right?
Mm.
Some people age better than others.
Mm.
However, if you're having symptoms, testosterone, it's all based off our labs.
Mm-hmm.
We plug them in, ask you your symptoms, put the pellets in, and I would say a good 90% of the people are happy with how they're feeling on the pellets. Women, it's every 3 months. Men, it's every 5 to 6 months. But I do think it's a personal choice. Some women are like, you know what, I've already been through that.
Mm-hmm.
They're not interested in the they think hormones are associated with sex only. They're like, I don't want any more of that because that kind of gets turned on. And so I can't make those choices for people. But for those that are searching for slowing the aging process, feeling and looking better, feeling alive versus, I see a lot of people walking by to go to the pharmacy next door to me using a walker.
Yeah.
I'd rather die before I get put into a memory unit.
Mm.
So slowing Alzheimer's onset. Like, I have a huge family history. I can't change that. So I'm going to do anything and everything to help fight that. And anytime someone comes in, we actually give them a book on hormones. We provide supplements to increase the benefits of those hormones that are put in. What else? And we manage those levels on people. So, but I guess there are risks. Estrogen is what breast cancer is fed by estrogen. So if someone was going to get breast cancer in their 80s, they may get it a little sooner if we give them estrogen. It's not the estrogen that's causing it. They were going to have cancer anyway. So
it just accelerates it if they're gonna if they already have it.
Yeah. So some people choose not to, just out of the fear that they think it's going to cause cancer. But like you said, that black box warning has been lifted.
Yeah.
It's doing more good than harm. So it takes a long time to get the FDA to do something like that. So
how long did it take? 20 years or something?
That's about how long it's taken.
At least they finally did it. I mean, versus just kind of like putting their head in the ground and be like, oh no, it causes cancer, blah, blah, blah. But at least they turned it around. But it's not, you got to kind of take health into your own hands sometimes and just look and see like what's gonna be the best fit for you in your particular situation.
Right.
So now I want to talk about misconceptions around hormones in particular. I know we talked about the black box warning that was lifted. People think that they're going to get cancer or develop cancer by taking hormones. What are some other common misconceptions you hear from your clients, from your patients when it comes to hormones?
Well, I have had some patients that have actually bought on the black market testosterone, self-treating. They usually come in for something like hair removal, right? So a lot more hair when women are using either the synthetic testosterone or they're self-medicating. Deeper voices, right? In some women, bigger muscles. Some of the things men might talk about is maybe shrinkage of the testicles. And, that's actually not a bad thing as you age, just saying, but from a women's perspective. But men seem to feel like they might be losing something. People worry about, will my body still make testosterone? Men usually worry, well, if I stop, will it still make testosterone? Am I having any problems if I decide to stop at any point? We were talking about misconceptions, right?
Yeah.
I mean, again, it's a personal journey. And some people just feel like, I think I felt just fine before using and putting bioidentical hormones in my body, I thought I felt good then. And then I tried the hormones. I was like, oh, this is even better. And the thing that got me really good was going to the dentist and seeing my teeth getting stronger between and having to, he's like, what are you doing? He said, well, I'm doing some testosterone therapy. So stronger bones, right? And estrogen too.
Yeah.
But I mean, I don't know where I was going with that, but lost my train of thought where I was. That's because I'm old, right? So that Alzheimer's could get me. It really could at some point. I'm fighting. So.
You gotta keep taking the hormones and keep going.
Oh, we have other treatments. I have other treatments for that. So
yeah.
For the mind, I have ExoMind, right? So
okay. So now, Christine, let's say someone is looking at these type of treatments, like the hormones or peptides or anything along those lines. Yes. But let's say that they don't know which provider to go to. What advice would you give to this person as they're doing their search so that they can find that provider that is trustworthy, that is knowledgeable, and that can basically get them the results they're looking for?
So for hormone therapy, for sure, I would say go to someone that's going to do your labs first, determine your dose based off your labs, listens to you and your fears. Maybe they start lower than the recommended calculation that's given. And then someone that can actually double check after the hormones are put in, checking to see that those levels are good. And if not, will they put more in? Someone that has a license to protect, right? So you gotta make sure the person's licensed. There's a lot of rogue providers out there. There's a lot of people that come from other countries and say they were a doctor in another country, and somehow they're acting as a doctor here, practicing medicine. It happens. We hear it on the news. They get caught, right? So.
Yeah, that's a great point you bring up as far as like the license part of it. So what's an easy way for people to check if a provider really has the correct license? What's an easy way for them to check on that?
It's usually Board of Health, some Board of Nursing, Board of Health, Board of Medicine. You can always do an active search for name.
Okay, so just go on Google, look up whatever the governing body is.
How do I find, check a license?
Okay.
In Florida, we have to have medical directors, right? So, what else? I had one patient that came in. Is a male. He's in his 70s. He's AFib on blood thinners, and I said, go ask your cardiologist, because I don't want to make his cardiologist angry with me for putting testosterone in him. He came back. His cardiologist said, absolutely, go for it. It's good for your heart. It's going to make you stronger. And then when he told his brother about it, his brother said, well, I want to go to her because she's checking and making sure I'm safe, right? So for men, we're checking their hematocrit levels. At least I am. Not everyone does that, but I do it because I don't want that volume to be so high that if they would have high blood pressure, maybe a clot, that they could have a stroke, right? So I monitor hematocrit levels, blood pressures, making sure they're seeing a primary care physician as well.
Okay.
And that their primary care physician knows what's going on. I've had a couple of people come back and say, yeah, my primary says XYZ. She didn't think I needed this. Why do you want this? And I said, how old's your primary care provider? Is she 50 yet? No, I don't think so. I'm like, okay, well, when she's 50, she's going to know why we do this, right? Because unless you're there, you don't really get it. Yeah. And I know there's a lot of younger people that want to be on hormones to build muscle and beef up. That's a thing, right? You've heard of that, right?
Oh, yeah.
All right. Well, yeah, we're doing it more to slow the aging process and for health, right? So it's not that we put huge doses in. Yeah. In fact, in my clinic, most people, they notice it the first time and then they just feel just good. And I've seen better moods. I've had some women walk in and they were miserable and their husband sent them. They're like, you need something. Go talk to someone about this. And then these people are changed. They're like new women, happy, enjoying life.
I'm sure
And
you
that's how
saved
I want
many
to
a
live my,
marriage.
huh?
I'm sure you saved many a marriages through this treatment.
Maybe, maybe. I'm waiting. Some of them I'm waiting for their husbands to come in. But their
Only a matter
husbands,
of time.
it takes a little while. It takes
Yeah.
a little while. They're like, I don't need that.
Yeah.
I'm good. I don't have that problem.
Yeah.
And maybe they don't,
Yeah.
right? Everyone's different. So,
Okay. And now, kind of within that same vein of those stories,
mhm,
I kind of like I love hearing stories like of just cases you've had in the past, maybe I mean, memorable
sure.
cases, or even I'm sure there were some challenging cases as well. Is maybe
Mhm.
another story that comes to mind that you can share of one of those stories of one of those cases and how you were able to get them a successful outcome in the end?
Mm. Well, I mean, it's usually if we're talking about hormone therapy, it's usually about managing those levels. Women that are in their 60s and up don't want to ever have to have their period again. And
Mhm.
that can be brought on because we're bringing people back to feeling like they were in their 30s again.
Mhm.
And so, reducing estrogen and listening to the patient. There are some things to stop any bleeding. We have some tricks, right? Either doubling up progesterone, or there's another medication that we can give in a low dose that will actually stop the bleeding. So I've been able to turn people around that were ready to quit, but then moved on and said, all right, I feel good. And they refer other people to me.
Mm.
Uh, I have one woman that she didn't continue. That's because she's caught traveling all the time. But she was like 70 and she just couldn't get here all the time. So, sometimes it's not for everyone. If you can't get to a clinic and you're traveling across the country, maybe uh, creams and patches are better for you where you have a little bit more control versus needing someone to implant some pellets. So,
Okay, so the consistency is the important part of it.
yeah.
Okay. Okay. Now, Christine, where do you think the future of aesthetics is going?
Oh, where do I think the future is going? Uh, hard to say. I still think it's going to be less filler, a more natural look. I think the BBL is now out. Like, I don't know. I'm not hearing a lot about BBLs anymore,
Hmm.
right?
Yeah.
I mean, I have a BBL device in my
Hmm.
clinic, but that's broadband light. It's
Hmm.
not Brazilian butt lift.
Yeah.
Um,
That's not confusing at all.
no, I think I think the younger generation is very focused on eating better, a lot more health conscious, less filler, prevention. Get a lot of younger people doing their Botox early
Mhm.
to prevent lines versus coming in at 70 saying, "Can you help me?" I'm
Yeah.
like, what do you, what? Why now? Why all of a sudden at 70 are you
Hmm.
looking to look better now, right? And there are treatments for that, but they end up being a lot more aggressive. Facelifts and CO2 type laser treatments, right? Where you have a couple of weeks of downtime. But I think it's moving more towards a little bit, more prevention and pre-treatment before it gets to the point. Because your face, I mean, just think of your mother, it's the largest organ in the body, right? So it also needs exercise. And so many people just don't do anything.
Yeah. Okay. Well,
And
something everyone to keep in mind. It's the whole
it's
package.
all education.
Yeah.
I mean, well, you got all your Instagram and your Facebook, but I think the lips are going to start going out soon. They look funny. I don't
Yeah.
know. Some of those people a little
Natural look.
overdone.
Yeah.
Small, right? Smaller breast implants.
Mm. So
I
more
think
natural looking then.
I think so. I think that's what I'm hoping for. That's why I got into it. I
Yeah.
I didn't want to look funny or
Yeah. And with that in mind, how does that
Mhm.
go into your vision for your practice, all new you?
Oh, it lines right up with my visions. So, I thinking, oh, I want to retire, but then I'm like, but I don't want to get old.
Mm.
I still need these treatments.
Yeah.
I need to keep doing this so I can look and feel my best because that's when I feel happy, right? If you
Mhm.
look good and you feel good, then people are much happier. I don't
Amen.
know.
Yep, very well said. Right.
Yeah, I mean, it's attached to health, I believe, right?
Hmm.
The mental well-being, right?
Yeah. Oh, yeah. Okay. Well, then, Christine, I have one last question for you. But before I
Okay.
ask it, I do want to point people to your website at allnewu.com.
Yes.
Now,
ALLNEWU.com, the letter
yep.
U.
Yep. Okay. And so, last question, Christine.
Mhm.
What does beauty mean to you?
Beauty, beauty. I mean, you hear beauty is pain. I don't think it's pain, right? So, um, well, they say, right, beauty is in the eye of the beholder, right? I mean, it's not just the external, it is also the internal, how you carry yourself. Um, Beauty, I don't know. I don't know what it really means. Let's say beauty. What does beauty mean to me? I mean, I've seen some really beautiful people, movie stars, right? Does beauty mean happiness? No, not necessarily. Does it mean you've got all sorts of money? No, you might get a nice job if you look good, but is that going to make you happy? I don't know. Beauty. What does it mean to me? I'm still trying to. I don't know that I've ever actually really thought about that. Beauty. I should have actually. I'm going to come up with a line for that now. Um, Beauty is in the eye of the beholder. That's someone else's line. It's not even mine, right? So, um, feeling and looking your best, um, enjoying life. Um, I don't know, beauty. Beauty. I don't know that's the most important thing in life, but if it makes you happy,
Mhm.
some people could care less what they look like. Does that mean they're ugly? No. No, some people don't need to do a lot of treatments. Are they
Mhm.
still beautiful? Yes. Yes. I don't know. I don't think it's all about aesthetics, but
Maybe
certainly
confident.
helps. Kind of like, what is money? What does money mean? Like, so there's
Yeah.
plenty of poor people that are super happy,
Yeah.
and then there's rich people that are miserable.
Yeah.
So um, it's, I
Maybe
mean,
it's confident.
it is about how you look and feel, but
Mhm.
no, maybe it's definitely instills confidence, I guess. So, right. So when I do hair removal for people,
Mhm.
women don't like having a beard.
Mhm.
It's very uncomfortable.
Yeah.
Feel men
Yeah.
feel a little more feminine. But
Mhm.
what about men? Don't men want to be beautiful too? It's a
Yeah.
different word. Handsome, right? They want to look and feel their best.
Yeah.
I don't know. That was a good question. Now I'm going to be pondering that all day. Beauty.
Well, for the next time someone asks you that question, you're gonna be prepared.
I'm going to have a better answer. Like, I don't know. Beauty to me is money in my pocket, but
Hey, it could
focus.
be. It could
That's,
be. It's what it means to you. So,
I know, I
okay.
know.
Well, there you have it. Christine sharing her expertise. So, Christine, where can people contact you in your practice?
Well, you can text or call 386-585-4008. You can also book online at allnewu.com. Let's see, I'm also on Instagram, allnewu_, on Facebook, allnewu wellness. And then I think those are the only ones right now that I have going. TikTok. I don't know if I'm going to do TikTok, but I've got multiple channels on Instagram and Facebook because I also have stand-up comedy that I
Oh,
do,
okay.
mostly surrounded by aesthetics. Right, a lot of the things that I do here
Mhm.
end up being funny, such as I put 100 units of Botox in my face last week,
Mhm.
and then the other day my phone didn't recognize me. True, it's
Oh
true.
man.
So I do a lot of stand-up comedy as well, associated with well, because I need a stress reliever
Yeah.
from what I do. I
Being an
mean, it's
entrepreneur.
well, yeah, that and sticking needles in people, right?
Yeah. Hmm.
I mean, it sounds fun, but it's scary, right?
Yeah.
So
Yeah.
dealing with people's faces and other parts of their body, their health,
Mhm.
right? So
Okay.
so
Well,
I need a stress reliever.
that's a perfect one for it.
It is.
Yeah.
It is.
Okay. Well, Christine, this is awesome. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your message.
All righty.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.